Hi, welcome. It is June 23rd, and this evening I'd like to talk to you about options for treatment of erectile dysfunction. So thanks for joining us. I'm Dr. Lance Walsh. I'm a urologist at Titus Regional Medical Center in beautiful Mount Pleasant, Texas. I'm a Texas native and did my medical training in Texas at Texas Tech for medical school and then UT Southwestern for residency. I did 15 years of private practice in Southern California before I relocated back to Texas, my home state, and in lovely Mount Pleasant. So thank you for spending some time with me this evening, and I'm interested in showing you the latest and greatest treatment options for erectile dysfunction. Okay, so the talk is going to I'll introduce what is erectile dysfunction, what causes it, erectile dysfunction as a health indicator. And also, I'll talk about treatment options for erectile dysfunction, many of which I'm sure you'll know, and maybe you'll learn some new things. And finally, we'll have a video that involves a patient educator, and then have a question and answer session at the end. So thanks again for joining me. We will have an option for questions, so if you have them, please type them in and submit them, and there will be a time at the end for us to discuss the Q&A. So, what is erectile dysfunction? It's defined as the consistent inability to sustain an erection sufficient for sexual intercourse. It could either be a problem with the ability to achieve an erection or the ability to maintain an erection that's satisfactory for intercourse. Facts about erectile dysfunction. Approximately 30 million men in America suffer from erectile dysfunction. So if you have it, you're not alone. 1 in 4 men experience some form of erectile dysfunction. Interestingly, most men with erectile dysfunction still have the ability to have an orgasm and father a child, but often have difficulty doing these things because they can't sustain an erection. It's not normal, and it's by no means an inevitable consequence of aging. In most cases, erectile dysfunction can be overcome, so it's a time to be optimistic. Okay, what are some causes of erectile dysfunction? There's injury, disease, an operation, for instance, if you've had prostate surgery for prostate cancer, for instance, and also substance abuse is associated with erectile dysfunction. It's important to understand that erectile dysfunction can be a marker for cardiovascular disease. The ability to get an erection is a vascular event. You get blood flow going to the penis, which leads to penile rigidity. Loss of erectile function is the earliest sign of endothelial dysfunction, and that's an early marker for coronary artery disease. So think about it this way. Your penile artery is smaller than your coronary artery, so if you have blockage, it's likely to affect the smaller arteries. That's why people get erectile dysfunction sometimes 5 years before they get a heart attack. So if you do have new onset erectile dysfunction, it's important to get your heart checked, either from your primary care physician or your cardiologist. Okay. Other risk factors for erectile dysfunction, clearly aging is one. Chronic diseases like high blood pressure, diabetes, depression, cardiovascular disease, and actually the medications used to treat high blood pressure like thiazides and beta blockers are notorious for causing erectile dysfunction. There's lifestyle risk factors as well, including stress, alcohol abuse, and smoking. Risk factors for erectile dysfunction, aging, there is a progressive decline in sexual physiologic function, an increased prevalence of chronic diseases, psychological issues, and relationship and partnership issues as one grows older. The most frequent reasons for office visits to primary care physician in men ages 45 to 64, no surprise, high blood pressure, diabetes, general medical exam, and disorders of lipid metabolism, the first, second, and fourth of which are all associated with erectile dysfunction. So let's talk more about specific risk factors, diabetes and hypertension. It's important if you're diabetic to have good blood sugar control. It's important not only for your other organs, but for your vascular system as well, and specifically with maintaining erectile function. If you're diabetic, you may already know about the risks of, or the complications of neuropathy or vascular disease. And if you're hypertensive, almost 70% of patients reported erectile dysfunction, and almost 50% reported severe erectile dysfunction. In this study, erectile dysfunction prevalence was correlated to the underlying vascular disease. Okay, so other risk factors for erectile dysfunction, and so you look at diabetes, prostate disease, peripheral vascular disease, cardiac problems, high cholesterol, high blood pressure. Each of those is associated with an increased risk for erectile dysfunction. The greatest risk is for diabetes. It's fourfold higher than the average person. Now, interestingly, prostate cancer doesn't cause erectile dysfunction, but the treatment options for prostate cancer, where either surgery or radiation, are associated with erectile dysfunction. During a radical prostatectomy, the nerve bundles may be damaged, and radiation, over time, the radiation therapy may damage blood vessels to the penis, preventing blood flow. One important thing that you can do is stop smoking. Smoking increases the risk of moderate to complete erectile dysfunction by twofold. The association between smoking and erectile dysfunction is likely to be due to impairment of endothelium-dependent smooth muscle relaxation. Okay. Medications, like I said before, thiazide and beta blockers are notorious for causing erectile dysfunction. So if you're on those, you may want to have a good talk with your cardiologist or primary care physician about considering other medications that may not have the same sexual side effects. So as I talked about before, erectile function is a vascular event. Sexual stimulation, excitement cause the brain, nerves, heart, and blood vessels and hormones to work together to produce a rapid increase in the amount of blood flowing to the penis. This causes blood to be trapped in the two spongy chambers in the shaft of the penis, and the emissary veins going from the corporal cavernoso bodies are occluded, and that leads to a rigid erection. In fact, in the right panel, you can see the large cavernosal bodies with the sinusoids. With complete erection, those become more dilated. Okay? So you can see if you have a problem with the arteries or blood flow going into the penis, this erection will not occur. Okay, so what are the treatment options? Everybody's heard of pills like Viagra, Cialis, Levitra. What you may not know is that if you take one of the medications at the high dose, they all have the same mechanism of action, so switching to a different medicine isn't likely to be more effective. The reason why there's different meds is they have different side effects and durations of action. And so if you have blue vision with Viagra, you can switch to Cialis, and if you have muscle cramps with Cialis, you can switch to another medication. All of them generally share the same side effects of headache, facial blushing, upset stomach, mild and temporary visual effects, and back pain and muscle aches. The problem with these medications is that they not necessarily work 100% of the time. The failure to work sometimes can lead to performance anxiety, and then over time they just may not work at all. The next option is penile injection therapy. This usually gives a fairly rapid onset of erection between 5 and 20 minutes. Disadvantages is that, most men have an issue with injecting their penis with a needle. Okay, let's face it. Not something someone looks forward to. But that being said, once you get over the mental hump, that it's not a big deal. You want to alternate sides using one side to the other because one of the components in it, papaverin, can cause scarring. And then prostaglandin, another component in the medication, this is Trimix, can lead to penile pain. This medicine is generally pretty good and safe. It's important that you get taught how to use it in your urologist office. And then oftentimes we start with a low dose and then escalate the dose. A potential other side effect or a potential downside to this is that the shelf life may be about 3 months and you have to refrigerate it. A vacuum erection device is probably the most cost-effective option. It tends to work well. The disadvantage is the erection may not be warm to the touch. There is a learning curve because you have to put a ring over the base of the penis to help maintain the erection. You may have inconsistent ejaculation. And finally, the insertable drug is a medicine that's put in the urethra And we generally don't use this very often because men don't like putting pellets in their urethra. But I just included it for the sake of completion, to be complete, that, it is another option for people that can't tolerate the oral medications. In terms of the surgical treatment options, there's a malleable penile prosthesis that is placed into the penis through a small incision in the upper part of the scrotum. It's fairly easy to use. It is a bendable device that you bend down when you don't want to have intercourse, and you bend it up to the straight position when you want to have penetrative intercourse. The disadvantage is that, it really stays firm when not in the erect position. So, it may produce a bulge. So that's really the main disadvantage with that. Kind of the Cadillac when talking about treatment for erectile dysfunction is the inflatable penile prosthesis. And the reason is that, one, it's easy to use. There's a pump that goes in the scrotum that you use to pump it up, that transfers fluid from the reservoir to the penis, where the cylinders in the penis. When you're done, you squeeze a little dumbbell at the top and then squeeze the penis to transfer fluid back from the cylinders to the reservoir. It's more natural flaccidity compared to non-inflatable implants, and it acts and feels more like a natural erection. And then you can pump it up, and it can maintain that for as long as you want it to be erect. Here's an example of the video on how to operate it. So, to operate the inflatable penile prosthesis, the pump is located in the scrotum. You can see the reservoir and the cylinders. The pump is squeezed multiple times until you achieve the desired erection. The more you squeeze it, the harder it becomes. Simple mechanical action, transferring fluid from the reservoir to the cylinders. After intercourse, and you want to take down the erection, you press the dumbbell at the top of the pump, you squeeze the penis, and it transfers the fluid back from the cylinders to the reservoir. Very simple device. Okay, so the risks of the penile prosthesis, any surgery has a risk of bleeding, infection, damage surrounding tissues, need for additional procedures. Specific risks related to the penile prosthesis include infection. If the device gets infected, we'll have to remove it. Also, once you have this, you can't go back to another treatment because this replaces the vascular tissue within the penis. It may erode, so you don't want to leave the prosthesis inflated too long, or it may damage the head of the penis. The components can migrate. Like with any surgery, you can develop chronic pain, or the device can malfunction. Those are some of the major risks. The good news, though, is that it's covered by most insurances. If you're interested in learning more about this procedure, you can contact our office or contact your insurance company to see what, if any, your out-of-pocket expenses might be. Okay? If you want to learn more, you can go to the website. There's one in English and one in Espanol. There's additional information on erectile dysfunction, penile curvature, incontinence, testicular implants. You can also make an appointment to talk to a patient educator. Patient educators are wonderful. They are usually people that have had the device. And then also you can find a urologist that specializes in erectile dysfunction near you, and look about insurance coverage information. So we have a video that we have ready to show you regarding patient educator.
Hi, my name is Stan Rydelic, and I'm 61 years old, and I live in South Carolina.
I'm Teresa Rydelic. I'm 60 years old, And I met this gentleman when I was 15 years old, and we've been together ever since.
I've been married to my wife, Teresa, we've been debating this, 39 years. 39 years. 39 years.
October.
39 years of bliss. About three and a half years ago, I ended up getting ill. I thought I had the flu. It turned out that I had complete liver failure. And so unfortunately, or fortunately, I had to have a liver transplant. As part of the procedure to nourish my liver, I found out what they did is they rerouted some of my blood flow. And so I ended up with a condition called arterial insufficiency, which basically means that the lower part of my body had insufficient blood flow. After I had my liver transplant and I was feeling well again, and then I found out that things were not happening romantically. It was kind of a surprise. So what I did was I asked my general practitioner, and so he immediately says, well, you know what? All you need is some Viagra. So what he did was he gave me a prescription for Viagra. I went home. I remember that evening, I was thinking, oh, how wonderful, Viagra. Of course, it's going to be a great evening. So what I did is I put some music on, poured some wine for my wife, lit some candles, and guess what? Nothing happened. So I went back and, and every time we're going in, it's just like it's 2 weeks or so between, appointments, and it's still like nothing's happening. And you start to really get very discouraged. So the doctor gave me a choice. He says we could use vacuum erection devices. He says, or we can also use an injection. So I said, well, let's try the vacuum thing first. That was horrifying. Well, first of all, in my opinion, it was horrifying. It didn't really work. So that was like a one-time shot. And then we tried it was Trimix that I tried. And so I thought that was going to be great. Went home, and again, since there was a tiny bit of success, I thought this was going to be a great evening. So you try to get all romantic, and then you say, oh, excuse me, honey, I have to go into the bathroom and inject my penis with Trimix. I did everything that I could, and quite honestly, I had never even heard of a penile implant. And so when this doctor I went to, he was a young gun, kind of like, cutting edge, and he says, I think the only thing that we could do, he says, to really guarantee that you can get an erection is a penile implant. So Teresa was a part of the process. She came to the doctor's office with me, and what we did is we had the discussion about it in penile implant, and she said, look, if it means that much to you, she goes, I want you back how you were. I want you happy. A couple things came up. The first one that I worried about was the procedure, a painful procedure. And quite honestly, I was told, and after experiencing it, it's an outpatient procedure. It takes less than an hour, in many cases a half an hour or less. Another thing that concerned me also, and this one's going to sound really, really very strange, but I really worried that I would have the desire to have sex.
Well, it's kind of ironic because that's exactly how I felt. I felt like, well, he's going to get this implant. We hadn't had sex in so long. Maybe that chapter's over. And I think that a lot of women worry that they're not going to be ready for this new adventure like they were. And it actually has been a renewal of our relationship in one area. And so I'm glad. I'm just glad it's freeing. It's taken on where we can be spontaneous, just so different than years before.
There was a romance. Yeah. There was a spark that was put back that we didn't know went out. The thing that's really, I think, been wonderful with an implant, with the implant, which I don't consider I have an implant anymore. It's just it's a part of me.
Right.
There's no, well, first of all, from the standpoint, if you look at me, if you saw me in the shower or whatever, you cannot tell that I've had an implant at all. And then also from the other standpoint is you have complete spontaneity. There is never anything where you have to say, okay, you know what, I'm going to take a pill and wait a half an hour for it to happen. If you're in the mood, you're in the mood.
Right.
And I mean, it turns back the clock. I mean, I honestly feel like we're in our 20s or 30s.
Since the implant, there's a confidence there that is actually very sexy. And that confidence is something that I think the implant did for us. And I don't worry that it was me, that maybe I wasn't something that he was needing. No, we're perfect for one another, and now we have back our love life. If I could give some advice to someone dealing with this, a couple dealing with this, I would say talk to one another, be honest and open and loving, because the answer may be no. The answer may be, no, I don't want to do this, and it may be, I've been thinking about this. So I think communication is the key.
If I could give a piece of advice to anyone suffering from erectile dysfunction, it is the fact that you have one life, and you have the choice to choose how you live your life and at what level of quality you live your life. So if you're suffering with something like erectile dysfunction, that's fine, you can live with it, but you don't have to. It's something that is so easily fixed, and you could have the quality back in your life that makes you a whole person again.
Well, thank you very much for joining us this evening. We do have a couple of questions from some listeners. So one of the questions was, I've already had a artificial urinary sphincter placed for incontinence after receiving a radical prostatectomy. Am I a candidate for an inflatable penile prosthesis? The answer is yes. Most of the time we do stage these so we don't put both implants in at the same time. And generally you can wait 3 to 6 months after the first surgery before you do the second surgery. So absolutely. Another question we have is, how soon after the implant is performed can I engage in sexual activity? The answer is generally we wait 6 weeks after surgery to allow it to completely heal before you're allowed to engage in sexual intercourse. And the reason is because even though it's a small incision, we want that to be completely healed. And we also want the reservoir, which we put in the abdominal wall, to create its space. So those are kind of 2 reasons why we want to wait about 6 weeks to do that. So we encourage any additional questions that you may have. Another common question that we get is, when I was 18, I used to be have really long erections, and now I don't feel like my erection is as long. The answer to that is generally the penis doesn't shrink, you get bigger. And so if you were to lose weight, and someone did a study about this, that for every 10 pounds of weight loss, you gain a centimeter of penile length. Not that it actually grows larger, but that when the fat melts away, you have more exposed penis. So that's an important one. And I'd say, what to expect if you're going to have a penile prosthesis insertion regarding the size of the implant is you want to place the penis on stretch, and then that is approximately the length you should expect with the implanted device. In the flaccid state, it certainly is not like a normal flaccid penis. I mean, it tends to bulge, and then I'm talking about the inflatable, tends to bulge a little bit more, and if you look at it closely, you could tell that it appears different, but the function of the penile prosthesis is to achieve an erection that you can have penetrative intercourse, and that's really the bottom line. So thank you very much for joining us tonight. Appreciate your time, and look forward to seeing you. We have additional webinars on this, and some webinars we will have live patient advocates. Today we had pre-recorded presentations from Stan and Teresa, our patient advocates. Sorry they couldn't join us in live today, but in the future we will have live patient advocates. So take care, and thank you for spending some time this evening with me.